My name is Roxanne Casaul. I'm your host for today. I am the Technical Screening Manager of Visa Solutions Healthcare. So welcome to our first webinar for this year entitled, What is Next Generation NCLEX or NGN? A very interesting topic, right? Some of you might say one of the most difficult international exams for the nurse to take. I agree, but we are here to give you an expert insights and a positive mindset to allay your anxiety about this exam. Stay tuned because there's a lot of information that you are going to learn from us. So, before we start, and while waiting for the others to join, you can chat or comment in our chat box and let us know what country you are located in so that I can give you a shout out. And so don't hesitate to participate with us. By the way, if you have other friends, colleagues, relatives who are nurses, you can invite them and tell them to watch our webinar today. If they cannot join anymore in our Zoom because they have a full pack of registrants, they can watch this even to the official global Facebook account, Visa Solutions Healthcare. And don't forget also to like and follow our Facebook account in Philippines. So what are you waiting for? You can give them a quick call or message them and to join and share this webinar. Wow, I can see a lot of messages right now. So I can say hello to everyone. So let me turn back to the other messages. So I can see from the Ghana, we have here also from UK. Hi, Kimberly. And for Canada, Ghana, Kenya, Philippines. And also we have here from Nigeria, a lot of nurses coming from different countries. We have in Trinidad and Tobago, and then also we have Nigeria, Greece. Hello, everyone. Welcome to our webinar. It's a good start because you are very engaging right now. We have from Zambia and also from Australia. Hello. It's a different continents right now. And then we have also in Kenya, United States, Dubai, and also from South Africa. A lot of nurses taking over right now and chatting right now. And then also from South Africa, Ghana, and Jamaica. Hello. Dubai and Ghana. So hello, everyone. I'm so overwhelmed with all the messages right now. So keep it going. Keep on messaging us. Say hi to everyone. And also, for those who are watching on Facebook, you can also give some comments and someone from VSH will check your messages. But I'm trying also to look at your messages at Facebook. So by the way, if we have also an account on Instagram, LinkedIn, YouTube, and TikTok, and you can get a lot of updates and learnings from us. It's a good idea that you are right here right now because aside from giving tips on how to pass the NCLEX, we will give you a big time opportunity. So because we Visa Solutions Healthcare will fulfill your American dream from the start up to the end of application process. So we are offering a well-defined program since we are the premier recruitment, immigration, and relocation agency. Also, we follow a direct placement model, and of course, a lot of benefits will be offered by Visa Solutions Healthcare, and one of which is the assistance in application and preparation for the NCLEX test. Take note, we never charge a fee for our services or any placement fee. Good news, right? And don't forget that. So moving forward, we are constantly doing online recruitment, but in the coming months, we let you know about some on-site recruitment events that will take place in a different region. For your information, our headquarters or main office is located in Woodlands, Texas. We have also offices and designated and directors in the international healthcare that manage the U.S. recruitment from the Philippines, Africa, Europe, Middle East, Canada, Latin America, and Caribbean. So watch out for this. And again, visit our website for more information about Visa Solutions Healthcare. Okay, let me go back to the chat box. I think I have already missed some of the comments. Hello from the Philippines, Ghana, UK, Colombia. Hello, Pakistan. Hello, everyone. I'm so happy to see you. Okay, and then Cameroon, Saudi Arabia. And then also we have a lot of United Kingdom here, Kenya, Ghana, Gambia. There's a lot of countries right now. It's a very diverse audience. I am expecting everyone to participate later on. So this is not only an informative one, but I'm expecting you everyone to have some conversation and interaction with me and as well as to Jeffrey Wright later on. So, and then also we have Uganda, Kenya, Sri Lanka. I think I can also read some countries because a lot of countries are here right now. So hello everyone. And then also, if you want to give in advance your question about our topic for today, don't hesitate to type in our comment section. And we will ask your question after the discussion with our guest speaker. And don't leave yet after his talk because we are going to give you more enlightenment and tips on how to ace this exam. And other details from our partner NCLEX Review Center, Rachell Allen Review Services. Actually, we are proud to say that most of our candidates enrolling Rachell Allen gain good passing rates since we are sponsoring the review and preparation for the NGN, especially for the nurses who had the job offers with us. I think I can start right now. There's a lot of viewers right now, so I can see many viewers coming in right now. So I won't keep you waiting for so long time, so we can start right now. So again, good morning, good afternoon, and good evening, especially for the new joiners. Welcome to our first webinar for 2024. What is Next Generation NCLEX or NGN? Okay, so I'm so excited with this webinar and to give you a warm takeoff of topic that surely help you decide on your plan or goal for this year, especially for the nurses. By the way, anyone who will be taking the NCLEX in the upcoming days, weeks, or months, can I see some messages right now? Oh, who is brave to spill the tea? Oh, we have here April 9, May. Anyone? This week, we don't have anyone who will be taking the exam April 9. Wow, gonna be near. I think I can say you are the right track of attending this webinar because after this webinar, you can say, I am ready to take the NCLEX and you are going to feel ready the American dream. Yes, I think I'm waiting to start with IPAS next month, May, March. Oh, it's gonna be near. So yes, I am giving you a positive energy and we are going to give you a positive mindset right now. So there's a lot more that will happen later on. So by the way, before anything else, I want to introduce myself for the newcomers. I am Roxanne Casaul, the Technical Screening Manager of Business Solutions Healthcare. Yes, I'm a nurse by profession. And another yes, I already passed the NCLEX last October for the first attempt. Yes, and that's why I am spreading my positive energy right now, especially for those who will be taking the exam. And I can't wait to introduce our speaker because he's one of my mentors when I prepare for this exam, and he was actually the first person who informed me that I passed the NCLEX. Yes, and oh my, I can still remember that day. So I know that you are all excited about this topic to help me on how he helped me to succeed on this journey. But before that, just a quick assessment. And I wanted to hear from all of you about your thoughts on the question that I'm going to give. So please prepare your keyboard right now. So a poll question will appear in your screen and please choose one answer. So there's no right and wrong answer in this part. So can you see the poll question right now? So once you already see the poll question, how many months do you need to prepare for the Next Generation NCLEX or NGN? Do you need 1 to 2 months, 3 to 4 months, or 5, 8 months is enough already to prepare for this one, or you need a longer time, 9 to 11 months, or 12 months or more? You can click the months or preparation for you to prepare. I think I can see some of the comment section that some of you 3 months, 4 months, wow, impressive. Or I can help you also to decide, are you a type of person who wanted to have a longer period of preparation because it's slowly but surely? Or some of you may say, I don't want to prolong my agony. So I wanted to prepare and also to have this exam. Okay, so I think we don't have, or you can see the poll right now. So you can chat your answer in the chat box. It is okay for you to chat your answer in the chat box. So I can see 1 to 2 months. Wow, impressive. I can say you're gonna do it. And the 2 to 3 months, do we have here answered 12 months and more? Mama, I need to prolong my energy. Okay, so I can see right now the answer. So very impressive, amazing results. So most of you answered 3 to 4 months. That's quite enough to prepare for that, 57%. The second one is, I think it's a tie for 1 to 2 months and 5 to 8 months. That's also okay. And then 9 to 11 months is 5%. And Mm, one, I think one only who answered 12 months and more. It's just pretty amazing. So pretty, it's also good to hear from you guys that you are also preparing and know how to prepare for this exam. So but later on, we will guide you and how important the preparation for this exam is, regardless of the duration. And we will showcase the discussion on the new test format for the NGN. It sounds scary to hear about the new test format, but we are here to help you by giving the up-to-date information, sample case study. Don't forget, don't leave because we are going to have a sample case study and this is going to be an exciting one. And of course, a better mindset for planning and taking this exam. I know you are so eager to hear the discussion, and why not bring out your pen and paper because I am sure that you will learn a lot from him. So here it is. Our guest speaker for this webinar is the Academics Review Manager of Rachell Allen Review Services. He's also a nurse, and as I've said earlier, he was my mentor. And I'm happy to introduce to you all Mr. Jeffrey De La Cruz. Hello, Jeff. How are you?
Hello, Rox. Good morning, good afternoon, good evening for all of our participants for this webinar session. And I'm looking at the question earlier about the preparation
Yes.
for the NCLEX. It looks interesting because
Yeah,
majority of
quite
candidates,
surprised.
majority of the candidates answered roughly about 3 to 4 months about the
Mm,
preparation for the examination. All right. And I would like to grab this opportunity as well to thank first the VSH team for inviting the Rachell Allen team to be part of this webinar session. And we're so happy and fortunate that we have this platform to give the right and accurate information about the things that all the candidates, right, planning to
yes.
take the test, because for sure they need to know the most accurate, right, information that they need to understand in terms of the preparation for the NCLEX examination. Do you agree, Roxanne?
Yes, I totally agree because there's a lot of sources coming out right now, but I do expect an expert insights coming from you, the exact information that will also give that information to the nurses when they are going to prepare for their NCLEX. So tell me more about yourself, Jeff, because I know to the fact that you are also handling some of our international nurses who applied in Business Solutions Healthcare. They are attending the free online review in Rachel Allen. So how are they?
Oh, that's a very good question, Roxanne. And just to make it clear, I think I saw some questions on the chat box. Are you sponsoring for the NCLEX review? Rachel
Yes.
Allen and VSH team have been partner for years already in terms of preparing candidates for the NCLEX examination. And mind you, the candidates from VSH are so intelligent. Okay,
Wow.
if they really
Oh, wow.
follow the instructions, right, they will really pass the examination. And Roxanne, just to give you a very good news for you, right, we have
Yes.
an excellent pass rate for all candidates
Mm,
under your team, under your Visa Solutions healthcare team. And we're so happy that generally speaking, we've
mm.
garnered roughly about 93% pass rate for the
Wow.
past year,
Amazing.
any case, in any status of the candidate, whether first time, second time, or for the nth time, they're going to be taking the test. We've got a very good pass rate of 93%, and that's verified for sure.
It's pat your back, VSH nurses, and I'm so proud of you. And I'm hoping for the other candidates to get also a good pass rate. And I can see in the chat box, there's a lot of students that you have right now. They saying hi.
Yeah.
I can see also BFIP and DFIP. I know the cardio lecture, so I can still remember your cardio lecture. That's the point they can still remember in your lectures. It's a good way that they can remember all your lectures.
Yeah, that's perfect. And to all my students in this session, all right, welcome aboard. And I hope you'll be able to learn more, right, as we guide all the participants in here in terms again of the preparation for the next generation NCLEX. And I think they're so excited right now to kick off this session, isn't it, Roxanne?
Yes, there's a lot of things that will happen today. So keep tuning us and don't leave the session until to the end of this webinar. So moving forward, we can have the second poll question, and you can help me also, Jeff, here, and then we can
Yeah,
also
sure.
answer from the result later on. So this is the poll question. I hope you can see right now in your screen. So what is the best learning strategy in preparation for taking the NGN or Next Generation NCLEX? Are you are you a type of person who love to do the self-study? face-to-face discussion, an online training, or you rather have a practice test, or all of the above? It's quite interesting, right? So I think I am excited for the result later on. So maybe while waiting for the results, how many years have been you teaching, Jack?
Oh, for almost 12 years, I've been conducting classes already for NCLEX under Rachel Allen. And,
Mm-mm.
I'm so excited to wait for the result of this question because this is the
Yes, I am
usual
also.
that concern of the candidates as they prepare for the examination. All right. Because if you're going to be asking me of what
Hmm.
will be the most appropriate strategy for the preparation before I answer for me before I answer that question, by the way, I'm just going to be waiting for the result to come out right now. All
Yes.
right. I'm
No
so
worries.
excited.
Yeah, I'm still waiting, but some of you are already answering all of the above. I was expecting actually that
Whoa, all
you're
of the
going to
above.
answer them. Oh, I see. And I had already anticipated this one. So most of you answered all of the above. 70% is a good survey, Jeff, especially for the training center,
Yeah,
right? Yes. So
correct.
second will be practice test or test banks with rationale. So 30%. Then the third one is online training, especially for those who are currently working. And then also we have here 5% face-to-face discussion and 4% self-study. Wow,
Yeah.
that's a good result. So I think you can answer right now based on you, what do
Yeah.
you think the best thing or the best learning strategy for you? Then I'll answer that also later on.
Actually, the best learning strategy will depend on the candidate. Okay. This is why the good
Yeah.
thing about the Rachel Allen program is that we are preparing the candidate holistically. So we try to assess first the learning preference of the candidate. And then with the learning preference of the candidate, we'll try to offer certain programs suitable for their needs. Because it's very important that for you to prepare for the test, you need to know your study approach, you need to know your learning approach for you to be able to benefit from that course that you are attending to. All right. So I agree with the
I,
result. It could be all of the above, but it depends on your most learning preference, right?
Yeah, I totally agree with what have you said. So if I'm going to answer that question, what I did last year is I attended the online review, of course, in Rachel Allen, because I'm currently working. Then I did the self-review after the training because I wanted to maintain the momentum. And tip number one that I can give to you in the is practice answering sample NGN questions daily as much as possible, especially if you have already a schedule of the exam, because you need to condition your mind and prepare your mind in answering the nursing questions until you reach the day of the actual exam. It really helps me that time. So that's why I passed the exam.
Wow. Congratulations again, Roxanne. So
Thank
proud of
you.
you.
Thank you. Because of you, because of all the mentors I had with the Rachel Allen. So I think we are just about to start, but I guess I have already shared a lot of information and also with you. So I think this is the time that we can start with your lectures. So I'll give you the floor, Jeff.
Oh, thank you so much, Roxanne. So I'm so excited to be here again and to guide these participants in terms of being knowledgeable with the preparation for the NCLEX examination, okay? But before we start with the actual discussion per se, okay, we need to go back first with this very important question that I want everybody to answer, okay? So are you excited for this question? Okay, so here's an important thing that I would like to ask all the candidates in this webinar session. Okay, all right, we're just waiting for the presentation to come over. So there you go. So here's another question that I would like all of you to answer first. Okay, should you be afraid of the next generation NCLEX? Yes or no? Okay, we'll just wait for the candidates, okay, to think about it. What do you think will be your perception, will be your idea about the next generation NCLEX? Should you be afraid of that? Yes or no? And I'm seeing answers already on the chat box, Roxanne, that majority of them are answering no. Okay. Yeah.
Oh, I think
Yeah. And
you're
I think it's a good
privileged to
thing.
answer that. Yes.
Yeah. Okay. So we're just waiting for the poll result to come out and let's see if it's 100%.
Oh my
Oh,
God. Yeah. You're
85% says no, I shouldn't be afraid of the NGN, okay? And 15% says yes, okay? And I'm so happy that most of our participants on this session says no, I should not be afraid of the NGN, because the first thing that you need to remember is this: your next generation NCLEX is not entirely a new exam. It's just a modified examination. So meaning they just added up some new question formats that will promote the critical thinking and decision making of the candidates. And I appreciate all your positive mindset in terms of your NGN examination, because another important thing that you need to bear in mind when you prepare for this type of examination is to have the right positive mindset. Okay, you need to think that you are a winner. You need to think that you will ace this examination perfectly. Okay. All right. So the first topic that we're going to be talking about right now is this. Okay. We need to talk about the technicalities very quick of the next generation NCLEX. Okay. But before I talk about this one, since Roxanne took her test last October, right?
Yes,
I want
yes.
to know your experience in terms of the actual NCLEX so that our participants, our candidates should have a good glimpse of the actual NCLEX examination. Okay.
Sure, Jeff. I can still remember that day, and it was a mix of emotions. So
Oh,
my exam stops at item number 85. Seriously,
wow.
my heart stops by 2 seconds. Yes, 2 seconds. I can still count on that. And then I took my exam for about 3.5 hours, and I made sure that I was in a hurry, but I made sure also to allot time in case it will exceed to more than 85 questions. But the good thing here is that I was able to do it in by 85 items. It was scary because it's either they were already satisfied with your answers or the other way around. But somehow I left the test center with a smile because it was a relief. I will not be studying every day. And finally I could sleep peacefully. So that's all my mindset. But again, I maintain the positive mindset that I would pass the exam. So manifesting I would pass the exam, and it happened. Thanks, thanks to
And
also this motivation, Alex. Yes,
yeah, it's a good thing for you, Roxanne. Okay. Thank you for sharing that wonderful experience. Okay. So, Roxanne, so proud of you. You stop at 85. And to guide these candidates, these participants in terms of your preparation for their examination. Okay. Here are the things that you need to bear in mind. Okay. The number of hours that you need to expect for the end examination is maximum 5 hours, okay? And the way they evaluate the candidate's possibility or probability for passing the NCLEX is that they used what we call your CAT or your computer adaptive test, meaning if a candidate is passed, it means that he or she is safe enough to render care for the client at that moment in time. All right. And how will you know that in terms of your CAT? So, meaning from the term itself, it's computer adaptive test. The computer will adapt to your performance in terms of your actual examination. So, like for example, if your first question is moderate and you got it right, so obviously your next question will be a bit difficult. But if unfortunately, if you'll be able, not be able to answer a difficult question, the next question will be a bit easier. So that's how it works on the actual examination. Okay. That's what we call your computer adaptive test. If you answered the moderate question correctly, your next question will be difficult. But if you didn't answer a difficult question correctly, okay, they will try to adjust the level of difficulty. They will give you an easier question. Okay. If you're going to be asking me the number of items that you may get from the examination, there is a range that they've mentioned under the NCSBN guideline. Each candidate will have a probability of stopping within numbers 85 to 150. So a student can stop at 86, 87, 88, 89, or 100, depending on your performance in terms of answering those NCLEX questions given to you. All right. But mind you, it doesn't mean that you stop at 150, you fail. Okay. It doesn't mean that you stop at 90, you fail. No matter what number you stop, it's a 50-50% chance, as long as you not yet receiving the official result from Person View or the Board of Nursing, we will not know, all right, the exact result that you will get. Okay. Next one. This is a very exciting thing. Throughout the examination, there will be 3 major case studies that will be given to you all throughout the examination. And here's the most common question of the candidates, okay? Sir Jeffrey, when is the best time, or what is the time wherein these case studies will come out? Okay. And I want you to grab your pen and write this on your paper. Okay. Usually these 3 case studies will come out anywhere between number 1 to number 85. Is that very clear? All right. Number 1 to number 85. So meaning if you start number 1 up to 85, there will be a possibility that those 3 case studies will come out on your actual examination. Each case studies will have 6 questions. So meaning if you have 3 case studies, you're going to be having 18 questions all in all. All right. But here's the most common question of candidates. So Jeffrey, will it only be 3 case studies? All right, here's the answer. Okay, there can be another case studies that will come out after number 85, again, depending on your performance. Okay, and the good thing about the engine is you're going to be experiencing your new questions or the new question formats that may be asked on your actual examination. And are you excited to see how it looks like? Because that is the usual concern of students. Sir Jeffrey, I don't know how it looks like. I don't know the presentation yet of the NGN approved item types. Do you have examples? You just listen to these presentation, to this session. We're going to be guiding you properly in terms of what to expect in these types of NGN new question formats. Okay, so for the next few minutes, I'm going to be presenting to you your different questions format, or what we call your types of question flow that may come out on your examination. Are you ready? Are you ready to see these examples, my dear beautiful
Yes.
some nurses? All right. Oh,
Yes.
good.
Before that, Jeff, maybe I can also give some reminders to the nurses before they take the exam, because I think some of them are also asking, what are the things that I need to do before taking the exam? We
Oh,
can
yeah.
have that. Yeah, I think based on my experience, of course, it's very good that you need to have, number 1, good and adequate sleep. You need to have those one, and also number 2, eat your meal before the exam, because either it's
Yes.
breakfast or lunch, depends on the time of your exam. You need to have a full stomach before you take the exam. And number 3, don't forget your passport. Some of the nurses are also very forgetful about that. Number 4, as much as possible, do not study or review on the day of the exam. Do not drain your brain cells on the actual exam. And number 5, the major reminder that I can give to you, don't be late. You need to be there 30 to 45 minutes before the exam schedule, because you have other requirements to settle in the test center before the actual one. This is very important that you need to be reminded.
I agree,
Okay.
Roxanne.
It's totally, because some of them, of course, they need to have some guidance so that they have also continue to exam, and as well as to continue their dreams to pass this exam. I think this is very important that we have also the question format right now.
Yes. So thank you for that wonderful reminder, Roxanne. Again, to all participants, don't forget your passport. Make sure it's not expired. Okay, just a friendly reminder. All right, in terms of what Roxanne,
Yes.
in terms of your guidelines for the preparation for the examination, and included to that preparation reminders will be your knowledge about what to expect on the question formats that may come out on your actual examination. Are you ready? Let's begin. The first type of question format that may come out in your examination is what we call your extended multiple response, okay? This is what we call your extended select all that apply. Why? Because the usual select all that apply questions will give you roughly about 5 to maximum 6 options. But right now, it's extended because the options are usually more than 6 already. It can be up to maximum 10. And since this is an NGN case study question, you will notice that there will always be a scenario on the left side of the screen. So my always advice to candidates is that don't jump reading the question, okay? You go read the case first. You try to understand the data given to you before you jump into the question and select appropriately the necessary option based from the case given to you. All right.
Okay, that's well noted, Jeff. I think one of the question that I can give to you is that you have mentioned that we have at least an options that we can select on that. So is there's a possibility for them to select all options for them to answer the question?
Oh, it's a very perfect question. If it's a select all apply question, there are two types of select all apply, okay? There will be a very basic select all apply, just like what you see on the board right now. So the answer here can be possibly just one option, two options, or it can be all of the options, depending on the case presented to you. Okay, but we have what we call your select all apply in, meaning the exam will tell you how many options should you select. And that's a wonderful thing right now. For example, they will say like this: select 4 options from the given choices, select 4 options related to the question. So meaning if they say 4, obviously you need to just answer 4 options. That's the good thing right now about the select all apply. All right.
Okay, so great.
All right. So I forgot to mention another exciting thing about the select all apply is that they practice what we call the partial credit scoring. So it's no longer all or none right now. You can have what we call your right minus wrong scoring system. So meaning you have now the possibility to have a good score, to have a good shot on your select all apply questions.
I have a question in the chat box. One of the candidate or viewers asked this. So what are the common questions that appear in the actual exam?
Oh, to spice up our session for today, I will
Yes, of
mention,
course.
go on with the last part of our discussion. Do you agree, Roxanne?
Yes, I know. You know what? Our viewers are very interactive. So that's why I'm also checking the Facebook. So they're very interesting on this webinar. So I think I can also put some questions on your in your discussion.
Yeah, I'll answer that question towards the end. For sure, for those who asked that one, you wait for the session
Yes.
to end, okay? So the
Okay.
next set, yeah, the next set of question format that may come out on your exam is what we call your extended drag and drop. The other term for that is what we call your arrange in order, wherein you need to choose the option from the left table and place your answers on the empty table that you see on the right side. Is that very clear? It's termed to be drag and drop because literally with the use of the mouse, you're going to be dragging the option and drop it on the other end depending on your desirable answer. Mind you, warning, not all the options given on this type of question can be included in your answer. So you need to be very careful on choosing the right option again based from the case of the client, okay? And that is what we call your extended drag and drop. All right, next one.
Yeah.
Another type of exam format question will be a close or closey item question. It's what we call your drop down list, okay? If it's a drop down list, meaning you need to click that box that you see on the right side of the screen. Once you click that box, there will be options coming down from that box. You just choose the right answer for you to complete the thought which is being asked on the case of the patient. All right. Another exciting type of your question format that may come out in your examination is what we call your enhanced hotspot. Okay. If we talk about enhanced hotspot, it's what we call highlight because literally you need to highlight certain information or data necessary for the case or the question being asked during that moment when you're taking the examination. All right. So again, the other term for this enhanced hotspot is what we call your highlight. Okay.
Yeah, actually, for me, this is one of the easiest format. But we wanted to know, I think nurses can also ask this to you. How many do we need to highlight here? What if the nurse highlighted 2 or more incorrect statements? So what will happen?
Oh, it's a very good question. Okay. So the thing that you need to bear in mind is this: you always focus on the question. Okay, so if the question is asking which of the following should you coordinate to the doctor, so you just need to highlight necessary data that may warrant reporting to the healthcare provider. So if you see 4 problems on the chart, for example, on the given data, so click those 4 information. If you saw 3 or 2, depending on how you analyze the scenario, that could be your way of identifying that at this point in time, I can answer 2 statements, I can answer 3 statements, or 4 statements, depending on what's being asked. And mind you, the scoring system here will vary depending on the presentation of the question. Okay?
It's a good insight. It's a good tips that you can give to nurses. More, Jeff. We are learning a lot. I am also learning a lot as well.
Oh, good job. Okay. So another type of question format that may come out on your exam. I like this question, to be honest with you, Roxanne. As an educator,
Yes,
this is a very good question in terms
I
of
know.
refining the critical thinking of the candidate. And that is what we call your matrix or grid. Okay. Why? Because this is a type of question wherein you really need to use your critical thinking, wherein they will give you interventions or assessment data, and then you'll be the one to decide, is it applicable? Is it indicated to the case? It's not applicable? Is it not related to what we're talking about right now? Or is this intervention bringing harm to the client? So therefore, you will place that under contra indicated. Okay, so this is how it works on matrix or grid. It's very important to know the concept very well and try to delineate or filter properly the interventions if it's necessary, not necessary, or will bring harm to what's happening to the client right now. Okay, this looks exciting for sure.
Yes, I agree.
All right. The next type of question format is what we call your trend item. Another favorite question of mine, okay? Wherein they will give a flow of data, multiple data presented on the scenario. It's trend because they will give data on certain dates, on certain time, and your goal as a nurse is to contemplate on those multiple data. You try to synthesize it and try to analyze what's wrong with the client depending on the given information to you. All right. So for you to be able to answer that question on the right side that you see on the screen, you try to look at the data first. You read it carefully, and we'll do some practice later on, and we'll try to decipher if what's happening to the client, what's wrong with the client, what should we do with the client at this point in time.
Yes. Actually, to be honest, Jeff, this type of format is kind of lengthy and time consuming to read everything. Seriously. But you need to focus on the question that being asked aside from the data given. It's usually seen in a standalone question wherein all the patient's information is included in one question. So in my experience, aside from what you are giving right now, I've encountered diagnostic tests like results of X-ray or Doppler. Of course, it depends on the case. And then I have a lot of laboratory tests, a list of medications, and even intake and output. So as if you are reading already a patient chart. So if it's necessary, I can recommend that you can use a writing pad or board for you to take down all that information that will help you to answer the question. And this will be provided by the test center. Don't worry. So you can grab that.
Yeah, that's correct. You have a whiteboard, shall I say? Is that what they call that? In terms
Yeah.
of writing down the data as you try to synthesize this information. And she's correct. It may not only be vital signs, it can be diagnostic results, laboratory results, right? Nurses' notes, doctor's notes, medical history, nursing history, depending on the case of the client, okay? And the last type of question format that may be seen on the actual examination is what we call bow tie. I like this question as well because your bow tie encompasses the areas that
Yes.
the nursing clinical judgment should be emphasized in a candidate. And it means that will really test your decision making. It's bow tie because the boxes looks like a bow tie. Okay. So what you need to do first is to read the case on the left side. And the usual advice that we give to our candidates is that you try to answer the middle box first, because the middle box will be the one to determine the possible problem of your client or the potential condition. Once you're done answering the possible diagnosis or possible problem of your client, you can go on the left two boxes. It's about the intervention that you need to do or to execute depending on the chosen case that you've answered. And on the right parameter, on the right side of the screen, you have two further assessments that should be noticed or should be done depending on the case of the client. It may look tricky, but if you studied very well and you find those keywords, you can actually understand immediately what's going on with the patient.
Okay, that's good to hear that. As well as I wanted also to give you an idea that bow tie is somehow difficult for me. That's for me because whatever you are going to put on that information, if you have mistakenly put that information, it's gonna be wrong. So it's very important that you need to be keen on the information on what you're going to put or drop on that. By the way, I have seen a lot of questions in the comment section. If you can type in all your questions, because a lot of very engaging. Actually, the viewers are very engaging, so you can also type in again if I haven't answered some question, but mind you, some question will be answered at the last part of our discussion. As well as I would like to recognize, of course, the Business Solutions Healthcare. We would like to say hi to Kelly. We have all the directors watching right now: Fred, Magda, as well as Amir. I think Maggie is also watching. So hi to everyone, as well as the Rachell Allen staff. They are also watching. So thank you very much for viewing us and as well as to having this webinar. Yes, and then also I think before we put or to have to proceed to the next one, I think it's very important as well that we should know if there will be a possibility for the test question in a case study that they can have one condition or disorder in one just case study. Is there a possibility to happen on that one?
Oh, Roxanne, I like that question so much. Okay.
Yes.
That's another question of my student earlier during my class. And the answer is yes. Your case study may be a combination of multiple conditions, right? So for example, a one case study, it can give you with a diabetes mellitus, with a kidney problem, and suddenly you had a stroke patient. So it can be, okay, a multifold cases. That's why I love NGN, to be honest, Roxanne.
Yes, I
Okay, because
know.
it will really challenge you in a nice way in terms of really getting into the core of the disease and try to really use your role as a nurse to provide the right care and the right approach as you handle those cases with one condition, two or more medical problem.
Yes, I agree on that. And maybe we can have the case study right now. It is very exciting part. Can I try answering this also?
Sure, Roxanne, you were my student before, so for sure
Yeah.
you can
Oh,
help our candidates, okay, to
okay.
really answer these questions. But before we move on with the case study, another question that I usually encounter as an
Yeah.
educator on the Rachell Allen team is that how should a student prepare for the next generation NCLEX? Okay, I will just give 3 guide points. Number 1, know your concept. It's very important to have a reliable resources in terms of preparing for the NCLEX examination, because there will be a lot of books that you can read. It will give you tremendous amount of information. That's why you have the responsibility to make sure that you need to filter out the necessary information and concepts that you need to focus on. And that is where Rachell Allen can help you on that. We've been doing this for over 15 years, and we know the concepts that NCLEX would usually love to ask on the actual examination, okay? Know the right concept. Second, I think you've mentioned this one earlier, practice, practice, practice.
Yes, I agree.
Right? If we talk about practice, you need to expose yourself with good amount, reliable sources of questions that may be helping you refine the way you attack, the way you analyze, the way you evaluate the case of the patient. Okay, so practice question is a must. And the good thing is that at Rachell Allen, when you enroll under a program, we'll provide you the necessary information and supplements before you start the review class, during the review class, and even after the review class, because we have exclusive question banks that are always aligned to the pattern or to the NCLEX format that you may see on the actual examination. And the last reminder that I want to say to students, if you want to prepare for the NJN, relax, you got this. Have the right mindset, okay? What did I tell you earlier before we start our session to our beautiful, awesome, and handsome nurses? You need to have the right mindset. Stop thinking that you are a loser in this journey, okay? Can you hear me? But start thinking that you are a winner. Stop thinking that you are not enough for this. Start thinking that you are enough for this and you can do it. All right? Am I right? Good. It's not about your background. It's not about your sexual gender, for example. It's not about actually the age. Okay, it's about your courage and your determination to make it happen. So I think they are now ready to start
Yes.
answering sample case study. Isn't it, Roxanne?
Yeah, sure. Before we start the case study, most of the candidates or the viewers also asking if they can have this recording because they have a problem in their internet connection in the location. So after this webinar, we will be going to upload the video in our YouTube account as well as in our website. So please visit our social media platform so that you can recall and then also repeat this webinar. All of the tips will be given. We will be giving it to you. Okay, we can now go to the case study. And don't forget, nurses, please make sure to answer also the question that will be given by Jeff. There's no right and wrong answer. You can try it. I will not call your name if you get mistake on this one. So let me try.
All right. So are you excited to our
Are you
participants?
excited?
Okay, let's bring it on. So I'm going to be presenting to you a sample case study that will be under the concept of health promotion and maintenance. Okay, so I will guide you properly. I want you to listen carefully in terms of how are we going to play around with case studies and be able to answer the right question. All right, so imagine you're in the right of the computer screen of your actual examination already. Try to imagine yourself. You're already immersing on the actual NCLEX environment, and here you go. You saw a first question, okay? So the first thing that you will do is this. Everybody go to the left side of the screen and let's try to read the scenario right now, okay? A couple presents to the urgent care clinic with their 27-day-old newborn. During the interview, the mother of the newborn states, "My baby has recently throwing up all the time and it's really disturbing. He tends to be hungry and fuzzy all the time." Okay, you stop and look at the data. Is your client here a very vulnerable population? Yes or no? Yes, it's a newborn. And what are the other data that will tell you that there is something going on your client right now? Is it because of the data telling you throwing up all the time? Yes or no? Yes. What is throwing up telling you? It means vomiting, right? And another data that we'll be curious about is that this client tends to be hungry. Are you getting it? So that will give you another inkling, oh, something is wrong with the kid at this point. But the data is not enough. We need to go further with the additional information that can be seen on other parameters. Like, for example, physical assessment. Everybody look at the screen. It says there poor skin turgor, sunken eyeballs, and dry skin. Is that a sign of fluid imbalance? Yes or no? Come on. Yes. What fluid imbalance, my dear beautiful and handsome nurses? Is it fluid volume excess or fluid volume deficit? Come on, bring it on. All right. It is fluid volume deficit. Good. So it's very clear right now that your client is experiencing a possible issue on fluid volume deficit. Okay. But here's another data that will tell you an insight about the problem. Movable, palpable, firm, olive-shaped mass have been noticed on the child. Is that very clear? All right. So what do you think is that palpable olive-shaped mass? We'll talk about that later on, okay? Look at the vital signs. 37 degrees centigrade, pretty fine. Heart rate 149, pretty fine because the normal heart rate in newborn is 120 to 160. Respirations will be 55. The normal is 30 to 60. It's pretty fine. Ultrasound is pretty good, 98%. Okay, here's the question. Which of the following assessment parameters should you further investigate, considering you saw your throwing up, sunken eyeballs, or skin turgor, palpable olive-shaped mass, right? And here are the options that you are seeing right now. But before I divulge the answers, Roxanne, can you help
Yes, I
us
know.
answer
I'm
these
about to
questions?
raise my hand to answer that
Okay.
question. Yes. So I can try answering this question and I will check if I can still remember what you have taught to me before. So my approach here is to connect the question to the presenting symptoms and the assessment of the infants. So I have a four option to choose. Let me know. I
Oh,
think some of you are already answering. So first, yes, all of you got it right. Is the weight because the statement is throwing up all the time. So I suspect this newborn is having an imbalance, fluid imbalance. And then also the second option is abdominal evaluation. So this is further assess the condition of the newborn. Possibly we can do some diagnostic tests to confirm the condition. So for example, it is the sonography or ultrasound. The third that I'm saying that is correct is to check the acid balance or acid base analysis. So I suspect this candidate is having a metabolic alkalosis. Is that right, Jeff?
oh, we'll see. Okay.
Oh my God, there's no answer yet. Okay. And then because that I think that's one of the priority or we can prioritize because of this condition of this candidate. And then also the fourth one, I think some of you are getting it right, the electrolyte panel, because through the continuous vomiting, there's a great chance for the imbalance, which imbalance of the electrolytes, possible potassium will be the depleted one. I hope I got it right.
Okay. So I think you got it right. Let's
Yay.
see how are we going to play around with the scenario. Here's the thing, my dear nurses, okay? When you answer a question, you always answer what's only important and necessary to the case. I ask you, it's a fluid volume deficit with signs of dehydration. So is it a must to check the weight? Yes. So number one is correct. Okay. Number one is correct. Did you get it? Okay. So I can check number one in here. Next one, should I conduct abdominal evaluation? Yes. You know why? Because it says on the data that there is palpable olive-shaped mass. And there is a pediatric problem that will be connected to your olive-shaped mass that needs abdominal evaluation. Is it necessary to check developmental milestone right now? What do you think? Is it necessary to the case right now? No. If it's not necessary, don't include it. Is that very clear? Number four, acid-base analysis. Do you think that this is an essential thing right now? Obviously, yes, because there will be signs of fluid volume deficit. All right. So, due to the vomiting, that's the reason why your client may suffer from fluid volume deficit. And I think Roxanne is correct that due to
Yes.
vomiting, your client can suffer from metabolic alkalosis. All
Yes.
right. Good. Is it necessary to check edema right now? Uh-oh, do you have edema if there's dehydration? Not too possible. All right. Is it necessary right now to check your cerebrospinal fluid test? Is it connected to the problem of the child? No. How about electrolyte panel? Come on. Will the potassium be affected? Yes, good job. Last one. Is it necessary to check the kidney and liver ultrasound? What do you think?
Not yet.
What do
No.
you think? Very good. It's not necessary right now. So nurses, the correct answer is what? 1, 2, 4, and option number 7. Is that very clear? So I repeat, the correct answer is 1, 2, 4, 7. So for those who answered it correctly, congratulations, you did a good job. Okay.
Yay.
But if you didn't get it right, it's okay. It's a learning experience. Okay.
Okay. I think the comment section in the Zoom is on fire. So I am also
Wow.
expecting in Facebook. So I'm still waiting for the Facebook viewers to also to answer. Don't worry. I'm also checking on that so you can answer as well.
All right. So we're done with the first question as a sampler. So we will now move on with the continuation of the case. Okay. So everybody look at the screen intently. Okay. So we're just waiting for the screen to change its presentation because we will now move on to another question that will be related to the case of the child. Hold on for a moment, please. Okay. All right. Look at this data. Still the same 27-day-old newborn, been throwing up, hungry, with poor skin turgor, sunken eyeballs, dry skin, and olive-shaped mass, okay? But there's additional data. There will be gastric peristaltic waves from left to right across the epigastrium. Is that very clear? All right, good. So in this case, if you're gonna be noticing, okay, there is a specific data that will give you a hint already the case of the child. If you encounter olive-shaped mass, what do you think about a pediatric problem in here? Olive-shaped mass. It's a very common question in the test. All right, I want to see the chat box flowing in. What do you think is a medical problem for kids that will give you olive-shaped mass? Perfect. That is your pyloric stenosis. Is that very clear? All right, but let's see if it's really related to your pyloric stenosis, okay? The next data will be related to the electrolyte panel, okay? As I can see, based from the reference, the sodium is technically fine. The potassium is a bit low. The calcium is just low by 1% or by 0.1, all right? And the magnesium is typically fine. Is that very clear? All right? So in this matter, okay, let's try to dig it into right now. So do you all agree that this is a case of pyloric stenosis? Yes, it's very clear. You have olive-shaped mass with signs of fluid volume deficit, and there will be peristaltic waves. It's very evident on the abdomen of the child. Is that very clear? Understood? Good. So are you excited to see how it looks like? Okay, so here's a very good example of that image, okay? All right, everybody, look at the screen. The upper part that you will see on the board is a very good example of a normal pyloric sphincter. So here's a very good example of a normal pyloric sphincter. But since you have pyloric stenosis, the problem is that there is thickening of the pyloric sphincter. Look at the lower picture. Everybody, let's do concept mapping in here. Since there will be thickening of the pyloric sphincter, do you think food will trap in the stomach? Yes or no? Food will trap in the stomach. Food will trap in the stomach because the food will be having difficulty to penetrate the pyloric sphincter. Come on, yes or no? Yes, because if you will look at the image very well, and I will draw it for you, my dear nurses, if there is thickening in here, food will be having difficulty entering that pyloric sphincter. So the food will stop in the stomach. Is that very clear? So would there be possibility of abdominal distension? Yes or no? Would there be possibility of abdominal distension? Yes.
Yeah.
And because food will trap in the stomach, follow-up question, my dear nurses, I know you can answer this, since there will be a lot of food stocking up in your stomach, will there be vomiting? Will there be vomiting? Yes or no? Yes. And because of that vomiting, will there be weight gain or weight loss? Weight gain or weight loss? Weight loss. Because of that vomiting, are you prone for fluid volume excess again or fluid volume deficit? Deficit. And the last one, because of that problem, okay, is your child prone to suffer from irritability? Imagine the child is vomiting from time to time. Yes or no? Yes. Are you learning about pyloric stenosis? Yes or
Yes, we
no?
are.
Yes, perfect. And look at the nurse's notes. The child was noticed, all right, to have explosive projectile vomiting, eagerly accepts as second feeding after vomiting. So in this case, no bleeding was noted. So it is confirmed that it is really an indication of pyloric stenosis. All right.
Yes.
Okay, so in this case, I think we're now ready to answer these question. But while we're waiting for the slide to come out, Roxanne, do you have any question about these phase?
Yeah, I think it is pretty informative. We have learning. We have a lot of learnings in this session. Of course, my initial impression for me, if I'm going to be attending your training, is that the newborn is experiencing pyloric stenosis based on the initial assessment that you have provided, especially the olive-shaped mass in right upper quadrant, because this is a hallmark symptoms for pyloric stenosis. But we will need to gather further data to support the impression that adds up also the vital signs and some statement of showing up all the times. And other times that we can use for that is the projectile vomiting. So sometimes in NCLEX, they use another term to describe the symptoms. So we need to be keen on that. Also, just a tip to everyone, you don't have to memorize everything. You just need to familiarize the condition and the presenting symptoms by recalling and understanding. I think I have seen someone who answered or who chatted that we need to have a repetition of all the information, because it's very important that we need to have those things and we don't need to memorize everything. And then also, then once you have already understand what's happening to the patient, that the time you can connect every details that it's being given in the case study. So the approach in NGN is for you to use your critical thinking, your prioritization, and the knowledge on how to manage a certain condition given an exam. So that's the tip that I can give.
This is absolutely perfect. So I think all of you are now ready to answer this question, okay? So based from the given data, which of the following finding may indicate that the client is suffering from pyloric stenosis? So click to the assessment right on the left side if it's applicable to the case based from our discussion, and click not applicable if it's not. All right, good. Is magnesium related at this point? Is it applicable or not applicable? What do you think? No. So I'll put a mark in here. Okay. Next one. Potassium, that's low. Is it applicable? Yes or no? Yes or no? Yes. Good job. Dry skin. Dry skin. Yes or no? Yes. Projectile vomiting. Projectile vomiting. Yes or no? Yes. And the most intriguing option, will that cause hunger? Since the child is vomiting from time to time. Come on, nurses, bring it on. Yes or no? Yes. Is it really gastric waves from right to left or left to right, depending on the data? All right. It says on the data, left to right. So we need to follow that. Okay. So I will put here not applicable because it says on the records, it's left to right. Is that very clear? Weight gain. Do you have weight gain for pyloric stenosis? Do you have weight gain for pyloric stenosis? No. Okay. Not applicable. Is a slight decline on calcium necessary right now? Necessary right now? Yes or no? Slight decline of calcium, is that necessary right now? Is that alarming, nurses? Yes or no? No. So that's your answer. And you're doing a super duper great job. All right.
Yes.
So that will be the information that you need to bear in mind in terms of your case study. Did you enjoy answering?
Yes, we are.
Wow, pretty good. And are you learning a lot despite we just give you just a primer of some case studies that you will encounter on the actual NCLEX examination? Okay. And I think, Roxanne, our participants are learning so far in
Yes.
a good shot right now.
This is amazing, Jeff. You never failed to impress me actually from the start when I met you. So very important also that, you know, all of the tips that was given by Jeff is pretty very important for you to pass this exam. Of course, very important as well that you have on this webinar, you have already the knowledge about the NGN, you start gaining some confidence already, I think so, and a better test strategy because there's a lot of things that being shared by Jeff. So with that, we can have some questions. But before I proceed with the viewer's question, I think this is one of the common questions that being raised by the nurses. So is there a possibility that you can answer this one? How difficult it is the NGNs more difficult than the old NCLEX, or it is easier compared to the old one?
It's a question since 2019 by our students. And the answer is this. The level of difficulty of the old NCLEX is just the same as the new NCLEX. All right. The,
Yes.
the exam promulgator, the NCSBN, made sure that the level of difficulty is on the same part or on the same level. But the good thing is that NGN is really exciting, especially case studies, because you are guided by data. And if you studied very well, as I told you earlier, you can be able to answer the questions fluidly. And mind you, they are so kind right now. The scoring systems are so good, okay, compare before. That's one thing that I want to emphasize, okay?
Yes. And then also, I think it is very important that we have a good foundation of the review materials and as well as a solid preparation for this exam. I think that's one of the key points that we need to emphasize to the nurses. I think this is one of also common question. How about SATA question, Jeff? To be honest, that's the type of question I feared before. So that's my second question. Is there a reason for them to fear on this type of question, or how can they can overcome the SATA questions?
All right. The first thing that you need to do is to accept the fact that SATA will always be there. Are you getting it? So do not pray that when you take the NCLEX, there will be no SATA. It will be a bit impossible.
Yes.
Are you getting
Mm-mm.
it? But here's Rachel Allen's tip, right? Whoever teaches at Rachel Allen, we say the same thing. We have lived by this very important approach in select all that apply. There's no other way but to master the concept. If you know the concept, you try to understand deeply the case of the client, for sure, you'll be able to select all the applied question. And based from your experience, Roxanne, you can vouch for it, right?
Yes. I think I got 5 to 10 SATA before when I took the exam, but that's it. I was able to pass it because of your
Yeah.
guidance.
All right.
Okay, so it's a good thing that you were able to answer that common question, but we can also have some question from the viewers, at least 2 questions, because we have a limited time to proceed. And then also one of the common question that I can ask is that what is the passing score for the NGN? I know this is different from the previous one.
All right. I want to make it clear, if it's about the passing score, meaning the passing percentage for you to actually make it for the examination. All right. That's a
Yes,
good question. Did I get it right, Roxanne?
yes, the passing
Yeah.
rate, yeah.
We have what we call your 95% confidence interval rule. Okay. Meaning, if you answered 95% of the passing level questions, you will pass the exam. And when I say passing level questions, these are questions under analysis and application questions. So to make it straight to the point, if you'll be able to answer 95%, all right, of those challenging questions under application, all right, an analysis level of questions, congratulations, you will pass the actual NCLEX examination.
Yes. And then also very important as well that they have the proper mindset, good mindset for them to take this. Yes. And then also, I think we can have the last question right now. Most of the viewers are asking for the materials because they are very interested on your lectures. So how can they get the materials? How they can enroll in Rachel Allen? I can proceed with Rachel Allen already.
All right, thank you for that, Roxanne. Again, Rachel Allen has been helping thousands of nurses across the globe to guide students in terms of preparing for the actual NCLEX. All right, we've been doing a very effective method in terms of guiding students, whatever your learning curve is. All right, in terms of preparation for the NCLEX examination. So you may visit our website at www.rachelallen.com, and you see already the information on the screen. So you can grab a photo of it, write this information, our emails, inquiries at rachelallen.net. We have our mobile numbers and landline numbers, all right? And if you are internationally located, we have our WhatsApp numbers so you can communicate with our team, and our team staff members will guide you on the right suitable programs that Rachel Allen is offering. Because mind you, we offer online classes. We have a 10-day class in the US. We have 21-day class that just runs for 4 hours a day that will save a lot of your time. And we have an on-site face-to-face classes being conducted in Manila, Philippines. If you want to have a face-to-face classes, that will be great for you.
Yes, and then of course we have we have a limited time to answer all your questions. Thank you very much for very engaging presentation, as well as for the candidates or for the viewers to whoever ever engaged with us. So if ever do you have a questions related to the topic that we have right now, you can contact Jeff and the team on the contact details being given by Jeff, as well as very important also to have that information, the review package that they are offering. So make sure also to visit their website as well as their Facebook account. So those are the information that they can give to you. So I know you are so eager. There's a lot of questions coming in, but again, we are here to discuss it once you have contacted us. And then also, any parting words, any before we leave, anything that you need to give some guidance to those nurses who will be taking the exam, as well as
All right.
those who have the ATT scheduled already.
All right. So for those who are about to take the NCLEX in a matter of days, in a matter of weeks, or in a matter of months, you always bear in mind you have given your best. Okay. Don't give up on your dreams. I know it may be tough, it may be challenging, but as long as you put your mind and effort to what you do, what you are working hard so right now will bear fruit sooner or later. Think that you will make it. Think that you will pass the NCLEX. And if you are, okay, thinking to join the Rachell Allen family to attend our classes, we will gladly welcome you and be able to help you fulfill your nursing dreams with the right mindset and with the right approach.
I totally agree with you, Jeff. And for me, as I'm a nurse and passed already the LGN recently, so 3 letters that I can give to you: NGN. N needs preparation. G, go for it, go for your goal. And N is never give up. So very important that you have the positive mindset, you have that kind of thinking that you can proceed, and don't ever think that you are not going to pass this exam. By that, I can give you a very important video. We can share a good testimonials from Rachell Allen. So before you leave, and before also we give you or to end this session, please watch this video. So again, thank you so much, nurses. Thank you for the viewers who watch this webinar. I hope you learn a lot from us, and I do appreciate the engagement. So please, if you want to have this recording, please make sure to visit the website of Business Solutions Healthcare, as well as the YouTube. We are going to upload this video. Thank you, and please watch the video. This is very important to all.
Rachell Allen is the crazy glue that puts you back together.
If I can do it, anyone can do it. I am ready to go and I'm ready to fight.
I chose Rachell Allen because I tried other avenues and they did not give me what I needed.
I graduated in 1994, and for me to be a nurse, it was something impossible. I let it go, I gave up.
So I've been struggling for passing this NCLEX about 4 years.
I myself have failed this test probably more than 2 times.
Coming from 2 fails, I was really stressed out. I didn't know what to do.
Since I graduated from nursing school, I've attended so many review classes and I've not been successfully. So when I saw Rachell Allen, everything that I said, oh my goodness, I never think I can become a nurse.
Whether you're taking it the first time or you're taking it the 20th time, doesn't matter. Come here, drop whatever you have going, come here, take the course, and you will do good.
I would tell anyone about coming to Rachell Allen. I'll tell everyone who can do it, I hope they come and do it, because it's awesome.
I highly recommend Rachell Allen School. You should come.
It's phenomenal.
No wonder nurses from around the world choose Rachell Allen.
I passed my NCLEX exam with Rachell Allen, and I am currently working as a registered nurse. Now passed by 75 questions with Rachell Allen.
I'm so happy to say that I'm currently working as a registered nurse.
Thank you, Rachell Allen. I am now a licensed vocational nurse.
They have made my dream finally come true.
Rachell Allen gives you exactly what you need to pass the NCLEX, as well as the confidence and the mental strategies to face the exam and the stress involved.
They have prepared me emotionally, psychologically, and spiritually.
I feel that they really have prepared me to take the NCLEX. I have never felt more confident, without a doubt.
To me, after 20 years to go back to this topics, like it wasn't easy, but they made it easy.
I highly recommend Rachell Allen. It's going to change your life.
I would highly recommend Rachell Allen. 100%, I highly recommend Rachell Allen.
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 I highly recommend Rachell Allen to everyone.
I highly recommend Rachell Allen.
I'm gonna recommend Rachell Allen to anybody.
I highly recommend Rachell Allen.
I highly recommend Rachell Allen.
I highly recommend Rachell Allen.
I love you, Rachell Allen. Thank you.